Open enrollment is underway for getting insured through Mass Health. There's also help with enrollment from the Mayor's Healthline. To tell us how it works is our guest from the Boston Public Health Commission, the Director of Health Access and Wellness Services, Beth Baker. Thank you very much for being with us, Beth.
Thank you.
First of all, we should talk about deadlines, or maybe that there isn't necessarily a deadline right now.
Sure. So for open enrollment for health coverage through the connector, it's right now, so it started November 1st and it goes through January 31st. So for a lot of people, open enrollment is the only time that they can purchase health insurance. So if you're someone who's getting a plan through the connector, a qualified health plan or connector care plan, you are bound by the rules of open enrollment. For someone who qualifies for Mass Health, which is Massachusetts' version of Medicaid, you're not bound by those rules. So someone who receives Mass Health or is maybe qualified to get Mass Health sometime in the future, you don't have to worry about open enrollment. You can apply at any time.
Well, one of the things you're trying to do right now is make sure more people get covered, because there are some pockets where there's more of a gap. Talk about what you're doing in the neighborhoods and which ones you're most concerned with.
Sure. So our two focus areas this year are East Boston and Dorchester. They have the highest rates of uninsured in Boston, and then certain census tracts in East Boston have actually the highest rates in the state. So it's really important that we get out there and let the community know that this is even available, because some people don't know that health insurance is available to them. So we're doing a lot of outreach events in East Boston. We're flyering, we're going to small businesses. We have an event coming up on December 14th at the East Boston YMCA, and that's from 12 o'clock to 6 o'clock. It's open to the public, and we'll be meeting with people, helping them complete the application for health insurance, helping them to understand what the different benefits are and the different health insurance options are for them. And they can choose a plan there that day with us, or they can then go back on their own and pick a plan and pay for it.
What is it you think people don't usually know about, especially as far as the benefits?
I'd say the one thing that people don't know is how affordable it is. For many people, health insurance may have $0 premium, so they're not paying anything for it each month, or very low cost premiums like $40 a month, that it's really affordable. Massachusetts has done a lot to make sure that health insurance is something that people can actually access. So I think people are confused by it. It's overwhelming. They're afraid that they're going to find out that the monthly premium is going to be something that they can never afford, so they don't even try to apply. So I would say to those people, just apply. And you know what? They can apply, find out that the premium is more than they want to pay. They're not obliged to then choose the plan. So they can go through the application process, find out what they qualify for, and they don't have to actually choose a plan and pay for it. I think people don't know all the benefits and really what's included. If you have health insurance, going to see your primary care provider once a year, it's free, completely free. No copay, no cost sharing, no co-insurance, it's completely free. So that's a big piece. And then the other piece is I don't think people know how many resources there are in the community, places to get health coverage. Boston is rich with community health centers, which, to be honest with you, I didn't know what community health centers were maybe until 10 years ago. And they're amazing resources, a place to get primary care. I go to the North End Community Health Center, and it's really, they're fabulous, and it's a holistic approach to healthcare. And we know about all the big hospitals, but there are these gems in almost every community.
Well, anybody would tell you healthcare is absolutely necessary for little kids and people when they get old. But if someone's young and healthy, an adult, they're missing. What's the big deal here? Why do I need to have health insurance?
Right. Oh, yeah, we get that all the time. So when we do outreach, I hear that all the time. I'm healthy. Why am I going to pay for something? I'm never going to use it. I get it. I've been there. After I graduated from college, I didn't want to pay for health insurance before I had a job. I would say to them two things. One, if you're ever in an accident or something happens to you, do you want to be stuck with huge medical bills? Probably not. But then some people are, well, what are the chances that that's going to happen, right? Like very small. I'd say to those people, those monthly, or not monthly, yearly just check-ins with your doctor are so important, and catching something early is so important to your health. Preventive care is huge. We see increasing numbers of people who have diabetes or pre-diabetes and other ailments, skin cancer and other things that if they're caught early, you're going to have really good health outcomes. But if you catch it at the point where you're in the ER because it's gotten so bad, your chances of doing well are reduced dramatically, and just a simple yearly appointment can make a big difference.
And I guess here, it's not just that you might go to a doctor and find out something horrible, but you might find out something that's not so horrible, but it might change your routine, you might change your diet, and that could have a lot of consequences down the line.
Right, and the doctor can also help you to understand how to get healthy, right? If you have high blood pressure, well, maybe it's that you need to be eating differently. And this is, again, where community health centers are great. A lot of times they have nutrition groups or weight loss groups, or different groups that can help support you achieve those health outcomes that your doctor or your nurse practitioner or your physician's assistant can guide you. Also, the other value of having a primary care provider, and again, that doesn't have to be a doctor, it can be a nurse practitioner or a PA, is that they get to know you. So you're meeting with them, say, yearly or twice a year, and they get to know what are your health issues, what's your family history, and having that relationship where you feel comfortable with someone, again, is going to lead to better health outcomes.
Well, what you're also helping people get through here is a bureaucratic process. Again, get a little confusing. You mentioned East Boston. There were people there who might be worried about their immigration status. Maybe the adults in the household don't have legal status, but they have children born in the United States. That sounds pretty confusing to me. Can you help people figure that out?
Yeah, we'll help everyone. People should not be worried about their immigration status. We also have great language resources, our team of navigators, and navigators are trained by the state, certified by the state, speak Spanish, Portuguese, Haitian Creole, Cape Verde Creole. We have Vietnamese speaking people. So, you'll be able to find services in the language that you speak. If someone on our team doesn't speak the language that you speak or your family member speaks, we have access to a language line. And that's important. It's confusing topics in your first language. So if your first language isn't English, we can make sure that we have someone speak the language you're most comfortable with.
Now, there are other ways you help people with health needs in the family, and I guess one of them is with nutrition.
Yep. So we help food security and making sure that people have access to healthy food. We can help people with SNAP benefits and applying for SNAP benefits. We help connect people to free food in the community, whether it's food pantries or low-cost food. So that's a resource. We have a phone line that's free, confidential, again, multilingual, open 9 to 5, and we can help people find primary care provider. Say they have health insurance, but now, I need to use it. We can connect them to a primary care provider in their neighborhood or close to where they work. And really, anyone who calls, we'll try to find. If we don't have the resources, we'll try to find and connect them to the appropriate resource.
Now, one thing about what the health line can do when somebody's trying to sign up for insurance is you have the question about all these trade-offs, because sometimes a plan with low premiums and high co-pays works for some people, but other people need a different kind of plan. Can they at least get some advice from you, or at least some explanations of those trade-offs?
Absolutely. It's really confusing, right? Like, you have plans that the monthly premium is really high, but then going to the doctor, you might have a small copay. So or if you have a lot of prescriptions, it's important to have a good prescription plan with your health insurance. So we can walk through with people what the trade-offs are. If someone is going to the doctors all the time, having a high premium but with low copays probably makes sense, but it's a lot to figure out. You definitely want to bring your calculator. We have them, but we can walk people through that, and just thinking about it like logically. Also, it's important that if you have a doctor who you go to, that your health insurance plan allows you to go to that doctor, so we can help people think about those trade-offs.
One more reminder, you have a meeting coming up in East Boston on December 14th?
Yes, Monday, December 14th. Again, open to the public. We'll have people there who speak a variety of languages, and if they don't speak the language, we can access the language line.
And the time and places is
12 to 6 at the East Boston YMCA.
And of course, you also have a number, the Mayor's Helpline, people can call.
Yes, so 617-534-5050, and again, open 9 to 5, Monday through Friday, free, confidential, and multilingual.
Thank you very much for being with us.
Thank you.
Beth Baker from the Boston Public Health Commission. In a moment, an art exhibition in the South End to benefit the Breast Cancer Foundation.